August 31st is International Overdose Awareness Day, with the goal to raise awareness, provide support, and reduce the stigma of drug-related deaths. Furthermore, spreading information in the attempt to better educate and prepare individuals as to promote the idea that overdose-related deaths and injuries are preventable.
In 2019, Dufferin County paramedics responded to over 100 calls where the indicated problem was directly related to drug overdose and alcohol intoxication. And with 3,000 deaths occurring nationally from opioids alone, it is a real threat to all Canadians.
When it comes to overdoses involving opioids, there are actions that you may take that can save someone's life prior to paramedics arriving on the scene. Naloxone is an opioid antagonist, meaning that it competes and attempts to remove narcotics bound to the opiate receptor sites within the body, thus reversing their effects. Opioid overdoses can be caused by both street and prescribed medications, such as heroin, fentanyl, Percocet, morphine, codeine, and methadone. Naloxone is available to anyone and does not require a prescription to carry or administer. You are able to obtain a naloxone kit from most pharmacies, walk-in clinics, or community support centers. It is supplied as either an injectable needle or a nasal spray. If you or a loved one are experiencing signs and symptoms such as seizures, altered levels of consciousness, agitation, paranoia, chest pains, or difficult, slow, erratic breathing, it is extremely important to call 911. If you are around someone who you suspect is experiencing an overdose, there are 5 key steps that you must remember. Step 1. Attempt to elicit a response. Shout their name, shake their shoulders, and rub your knuckles on their chest firmly. Step 2. Call 911. Step 3. Give naloxone. 1 spray into a nostril or inject 1 vial or ampule into an arm or a leg. Step 4. Perform rescue breathing and/or chest compressions. It is imperative, if you do not feel a pulse, to begin chest compressions, as naloxone will not start the patient's heart. Step 5. Is it working? If no improvement after 2 to 3 minutes, repeat steps 3 and 4. If you have to leave the person for any amount of time, make sure to put them in the recovery position. This is key in preventing aspiration.
In all cases, you still need to activate 911 and wait for paramedics to arrive, as naloxone may work up to 1.5 hours depending on the amount and type of drug in the person's system. There is a high risk of rebound overdose and other side effects when dealing with multiple drugs. With continuing education, funding, and support, we can strive to make drug overdose related deaths a thing of the past.